10 dangerous drugs that can kill you, and many you use daily. You have them in your bathroom, in your medicine drawer. Some can be extremely dangerous, even those you use regularly for pain, insomnia, or colds. Today, we'll discuss 10 drugs that can be lethal if used excessively or incorrectly. Grab a pen and paper. Our 10th drug today is non-steroidal anti-inflammatory drugs. They are extremely dangerous. I'll explain why now. First, why are they dangerous? They're sold over the counter, so anyone can go to the pharmacy, talk to the pharmacy attendant, and say, "Hey, my friend, I have back pain, I have leg pain, I have a headache, I have a sore throat." And then what will they tell you? "Don't worry, just take this ibuprofen, diclofenac, lime solida, or ketorolac." But these meds, even if prescription only, can pose serious risks to your health. So let's discuss what are the health risks these drugs can cause. First, gastric ulcers. Anti-inflammatories block COX-1 and COX-2 enzymes, reducing stomach lining protection. This makes your stomach more prone to ulcers and bleeding. Many deaths from non-steroidal anti-inflammatories are due to gastrointestinal bleeding. These drugs can also harm your kidneys, causing renal failure if used excessively. Long-term use of high doses can even lead to heart attacks and strokes. Combining with blood pressure meds can be even more dangerous. All right, let's talk about anti-inflammatories. Meloxicam, ibuprofen, diclofenac, and others shouldn't be used for over 3-5 days, okay? There are other options for treating pain. Medical cannabis, for instance, is an interesting alternative. For more info, visit clickcannabis.com to find prescribing doctors who can help you. The 9th medication we need to be careful with. This one's also sold over the counter. Anyone can buy it at the pharmacy. It's a drug often prescribed by doctors, one of the most common meds for pain and fever. But what's the issue with this medicine? It's highly toxic to your liver. So this medication, just to give you an idea, is one of the main causes of liver failure worldwide. It's one of the primary reasons for liver transplants, often due to its misuse by people who intentionally, you get what I'm saying, right? I'm talking about acetaminophen. Acetaminophen is what I'm referring to here. The problem is its toxic dose is very close to the recommended dose. Our 8th medication, and this one's an epidemic, isn't it? Many people use this drug to sleep or calm down. The big issue is once someone starts using it, it's hard to quit due to physical, psychological, and chemical dependence. I'm now talking about benzodiazepine. Dr. João, what are some benzodiazepines? Clonazepam is the most well-known. What's the brand name for clonazepam? Rivotril. We also have lorazepam, alprazolam, and diazepam. So all these medications known as benzodiazepines are very dangerous, hence the black label. Be extremely cautious with them. 7th are antidepressants, serotonin reuptake inhibitors like fluoxetine, duloxetine, venlafaxine, and tricyclic antidepressants, which are less common now and often considered secondary options. The 6th medication is also dangerous, and I see many children using it. It creates a strong dependency in people, those who can't leave home without nasal spray because their nose gets stuffy and they can't breathe. So nasal decongestants like oxymetazoline, phenylephrine, and similar products are popular for cold relief, but overuse can cause a rebound effect, where the nose becomes more congested after continuous use. This long-term medication also raises blood pressure, causes heart issues, and can damage your nasal lining. The 5th dangerous drug that can be lethal, and I actually lost a college friend due to this class of medication. He was also a doctor, already graduated, and sadly he fell into fentanyl addiction, a drug used in anesthesia, which is used for severe pain relief, but highly addictive and risky in overdose cases. 4th drug, less used now, is digoxin, once common for heart failure and arrhythmias, but with a very narrow therapeutic window. This means its effective dose is very close to its toxic dose. So if you take too high a dose, it can cause fatal arrhythmia and digitalis poisoning, which is more common in elderly patients, causing nausea, blurred vision, arrhythmias, confusion, fainting, and death. The third medication we need to be careful with, and this one will surprise people, like, what? No way, Dr. João. It's aspirin, acetyl salicylic acid. Of course, it's a safe drug when used correctly, but it can be dangerous in high doses, especially in children, potentially causing Reyes syndrome. That's spelled Reye. It can cause severe bleeding, especially in people with ulcers or gastric problems. And these hemorrhages, these bleedings can be fatal depending on their severity. Okay? So aspirin is also a medication we need to be careful with. The second medication that can be dangerous if misused are antibiotics like ciprofloxacin, amoxicillin, doxycycline, because while essential for treating bacterial infections, misuse of antibiotics can lead to bacterial resistance, and antibiotics won't affect viruses at all. They'll only kill bacteria, including the beneficial bacteria in your gut. So antibiotic use must be extremely careful, but sadly, it often isn't. In 30 years, antibiotics might not work anymore. Why? Bacteria will become resistant, and what's already happening will occur more frequently. We'll get a patient with an infection, do an antibiogram to see which antibiotics are effective against that bacteria, and find it's resistant to all. This happens now in 2024 and will worsen if antibiotic misuse continues. So let's be very careful with antibiotics. And our first one is insulin. Insulin is essential in treating diabetes, but if the dosage is wrong, if it's too high, it can lead to severe hypoglycemia, a drastic drop in blood sugar levels, which can be fatal. Diabetic patients who use insulin need very strict dose control and must be careful when injecting, because such a drastic drop in blood sugar levels can lead to death. There's another important message, especially for those with diabetes, high blood pressure, high cholesterol, poor circulation, anxiety, insomnia, or stress management issues. If you have these issues, you might not know you can treat them naturally. There are proven strategies that don't require doctors, tests, or medicines to treat these issues. If used correctly, these strategies can even eliminate the need for medication for these conditions. So if you have diabetes or high blood pressure and follow these strategies precisely, you might not need medication anymore. Imagine how great it'd be to stop taking losartan for your high blood pressure, or to stop taking metformin if you're a type 2 diabetic. Well, it's possible. I teach you how in my book, The Longevity Code, which has 101 habits to live past 101. These habits can prevent diseases. Want to know which ones? Heart attacks, strokes, cancer. They can also treat and reverse today's major health issues: type 2 diabetes, high blood pressure, high cholesterol, poor circulation, obesity, anxiety, insomnia. All natural solutions, no meds, no contraindications, no unwanted side effects. Interested? Want to improve your life, boost your health, and increase your energy? Here's what to do. Click the first link in the description to get your longevity code. By clicking that link, you'll access a huge discount. Instead of $80, you'll pay just $39.90, over 50% off, plus an unconditional satisfaction guarantee. What's that mean? If you buy the book, read it, and don't like it, I'll refund your money. I'm making this commitment. No tricks, no red tape, no fine print, no deception. I'm taking the risk of refunding your $39.90, having my team work for nothing, and worse. I'm also risking a penalty fee I'd have to pay if you request a refund. So folks, I'm taking this risk for you today because I know when you read the book, when you put it into practice, you'll start seeing major improvements in your life and health.